evening and welcome to another edition of Montpelier Connection. I'm State Representative Mike Mrowicki, and here we are post-election with a pre-legislative session show today. And our guests are our two state senators, Senator Balint, Senator White. Welcome.
Thanks.
You both are fresh from your re-election, and it was quite an interesting election. I would say Vermont, there were no big surprises in Vermont. There was a tough election for governor, but when there's an open seat, generally the better well-known candidate comes out, and I think that's what happened. It was a tough election nationally, though, too, and I wonder if you have any thoughts about how that's going to affect the state or the nation.
Well, it could affect the state dramatically as we look to who's going to be the AHS director, who's going to be the HUD, where are funds going to come from? Are we going to be losing funds? What's going to happen with health care? It could have a huge impact. My general feeling is that this had better be a call to action for us, and that we need to make sure that we are vigilant and don't get so down in the dumps that we become immobilized.
That's pretty much what I've been hearing from people, that it's a call to action, and people want to know what they can do now, and it may be energizing, and there's a good thing to come out of it. That's so.
Yeah, I agree with Senator White. It is a time when we really need to know the details and we need to get organized. On a personal note, it was a very challenging week after the election. My paternal aunt, she lost her father in the Holocaust, and she lives in a very red state. And speaking with her in the days after the election was incredibly emotional for her, because she felt like so much of the rhetoric that she had heard in this election was completely mirroring what she was a child then in Germany and Hungary. So it's personally been a tough time to try to make sense of how we got here. And how do we ensure, I know I speak for all three of us, how do we ensure that our civil liberties are protected?
You bet, a good start, I believe our governor and governor-elect have made a public statement to that effect. House Democrats have just put out a public statement similarly, and I think people are coming together. Vermont has been a leader over the years, starting from abolition to marriage equality, and I believe we will continue to be a leader in that way.
You noticed that the press release that was sent out by the governor and the governor-elect was also signed by the president of every higher educational institution in the state.
That's right.
So that was good to see.
And looking ahead now to the session, which will be starting in a month or so, we've got a lot of work to do. As usual, the budget is going to be a concern. We try and live within our means, and we have been. It'll be interesting, though, to see how this change of administration happens. Are there any things from last year that you still want to pick up? Ideas for the coming year besides that, too?
Well, I'm very eager to get back. We had pulled together a committee to look at corrections and numbers over the next 10 to 15 years. How are we going to be able to manage the facilities that we have, with the goal of hopefully bringing the prisoners home who are currently out of state. So that is something I'm eager to look and see what came out of that working group. And also I'm interested in revisiting the issue of, it's called compassionate release, but there's a lot of other ways that you can couch it, but really looking at folks in corrections who have served a significant amount of their time, who are of failing health, and how do we...
Generally pretty old.
Indeed, yes. And so I know one of the sticking points, it passed the House last year, it did not get out of committee in the Senate, and part of it was really looking at that sticking point of what housing is available and what facilities are available to meet the needs of these folks who are incarcerated who have significant health issues. But I was on the phone with a couple folks today who are interested in looking at that again, and perhaps being able to do some of the legwork beforehand of figuring out what those housing positions could be so that it makes it a more feasible piece of legislation. But we really want to work on reducing our corrections population. I know it's something that so many of us believe in, and it takes some very hard decision making to actually get that achieved. So that's something I'll be continuing to work on.
Yeah, and I think that's, I'm hoping again to be on the Judiciary Committee, so hopefully we'll be able to work on that in conjunction with the group that's been working on it. The other thing that goes along with that is the whole, well, a couple things. One is the whole organization and funding of the judicial system. We need to pay very close attention to that, because they're so stressed that I'm not sure that people are getting the justice that they need in a timely manner. And along with that, somewhat related, is law enforcement and how we provide law enforcement in the whole state, because we have the Vermont State Police, then we have other state officers, and then we have 80 agencies out there. So we need to look at...
It's really not organized.
Well, it isn't. They're all, the 80 agencies are all independent entities. So we need to look at coverage. I think we need to look at training. What kind of training do we provide at the academy? And so I am hoping, you asked about the committees, and I am hoping to be on the same committees next year, which is government operations and judiciary, because those issues fit right in with them.
And I'm hoping to remain on economic development and housing, two issues that are very important to me. And so we have a study coming back from JFO that they did looking at the towns along the river corridor and how the tax structure impacts them, the retail tax. So I'm curious to see, some hard numbers around that. I think we all are.
You mentioned housing before. One of the things I've been hearing during the campaign, even before, housing is becoming a barrier to economic development.
Absolutely.
It's becoming a barrier on so many levels to helping keep or bring young people to Vermont. And Burlington and Brattleboro have these incredible shortages, but the rest of the state as well is struggling with that. What can we do?
Yeah, it's a great question, and it goes back to what Senator White was saying earlier. There's so many unknowns at the federal level. I'm not really sure. We tried to get a pilot through that would take off the infrastructure costs off of new build, but we weren't able to get it through appropriations in the last few days because there were other pressing needs. And so I wish I had an answer for you, but it is something that we have to wrap our heads around, because we can't bring the workers here that we need. And we say that we want to attract more young families, and the housing just isn't there to support them. And so
I think one of the things that we need to do is we need to look at kind of the whole of housing. We tend to divide it up into affordable housing, public housing, homelessness, shelters, upper class housing, middle class housing. I think we need to look at the whole ball of wax, because it all has an impact on everything else. So if we looked at the whole thing, then I think that there are probably some solutions out there that are tiny. They might not make a huge impact, but we can start. I think that we can do some things if we really look at what we mean by housing, having people have shelter.
And absolutely. And if we look at some programs that are already in place that are working well, so putting the apartments in existing houses, and that program is working really successfully. And when I met with the town manager about it some time ago, he said, but it's only this certain number. I said, but that's more than we had before. So, and that's how we're going to have to attack the problem is this piece at a time. And I agree with you. It is because we are stressed at all levels of housing. It isn't just
Right.
low
It's a-
income.
And that doubles back then to zoning and how we deal
Sure.
with zoning issues in our towns and our
Yeah.
villages, and do we allow infill
Yeah.
Right.
housing? And so
Yeah.
it is complicated, but I think we can, if we take a coordinated approach to it, we can
And I
have
think there's
some
a
impact.
new energy around it and new awareness of how much this is an impediment, that we have numerous employers in Windham County who cannot find
Yeah.
the workers. And so, and we talked about this the other day at the summit we had on making it work in Vermont, is that we have brought in folks for jobs either at the hospital or the retreat. They've come to look, and they look around and say,
And these are people with good incomes, good credit, and
Absolutely.
good histories that are
Exactly.
having trouble finding. So,
right, something that...
on the
that
other
we're
end,
gonna-
imagine what it's like if you don't have that.
Absolutely. And it's one of the things, maybe Valerie Stewart will talk about it more when you have the House members in, but I know she and I have been in communication with the folks who coordinated the Tiny House Fest,
Yeah.
because there was a group in Greenfield that was able to get some town land in Greenfield set aside for a pilot,
Yeah.
whether it is for low-income folks or whether for homeless folks. And so it is,
Yeah.
it's going to take a multi-pronged approach. But I do feel like there's a new awareness that this is a barrier to economic development. Yeah.
And I would be remiss if we didn't mention the good work locally with the Housing Trust.
Oh, absolutely.
Statewide, the VHCB, the Vermont Housing and Conservation
And
Board.
public housing authorities.
Right.
Public Housing Authority.
Thrilled that Red Clover Commons is opening up
I
and they're
know, I
moving
know.
in, and
that's very exciting.
It is.
It is very sad to see
sure that community.
that community
Yeah.
broken up, and those 80 little cute housing
Yes,
units.
I know.
I mean, that's
Yeah.
a loss.
Yeah.
One of the concerns I've heard since the election, though,
Yeah.
is that the last time the administration before the Shumlin administration easily took aim at trying to cut the VHCB, and we had to be very vigilant. Conservation and housing are both equally vital to the Vermont that we know
Absolutely.
and love. I would imagine we'll still have to be careful about that. Any thoughts about how we can continue that? And if there's a concern that we'll again have to be on the watch for bills that show up and have attached to them a cut in the VHCB?
Well, I don't know if it's so. I mean, that would be in the institutions bill and the budget, but I think it's more than just cutting the funds, because if you remember last time, there were these groups established called the Tiger Teams,
Right.
and the Tiger Teams focused on an issue, and the Housing Tiger Team had no one on there that knew anything about housing. It was-
It makes it hard to
it did
pass
make it
effective
hard.
policy.
I attended those meetings, so I think that's what we have to.
Yeah.
We have to make sure that it isn't just the funding; that there are other ways of, and it was aimed at nonprofit housing at that point, other than just VHCB. So we have to keep on top of that.
I know in the House there were numerous attempts to put floor amendments out there that said if you want to spend this money, take it from the VHCB.
I think it will be very unpopular,
Yeah. Yeah.
and we will be vigilant.
And I think the fact that Vermont has combined housing and conservation together, which other states haven't
Right.
done. They
They-
fight with each other.
Yeah.
instead.
Exactly.
Yes.
I've been at
And-
national
yeah,
conferences where
yeah.
they say that's a great idea because you're right. Usually those are competing interests.
Right.
Absolutely.
And so this way we have a much larger base.
Yeah.
to-
Exactly.
Yeah.
To rally.
Yeah.
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 So
Yeah.
we will be vigilant about
Yes,
that. So
absolutely.
And about everything else.
rest assured, the conservation housing are very important to us.
Yeah.
Yeah.
Health insurance, and I don't call it health care because we're talking more about health insurance, the exchange, Obamacare. What are you hearing from constituents up until now, and Where do we go?
I know I've been hearing from constituents who have been writing to me directly that they're afraid that if the Republicans in the Congress and the president-elect follow through on their plans to repeal Obamacare, we have constituents who are very frightened that they're going to be back in a situation of either having health care that they can't afford, health insurance they can't afford, or simply have no coverage. And that's untenable to imagine going backward in that way. And so people are scared. I mean, it goes back to that, where we started, which is that there are real material issues that will directly impact low-income and middle-income Vermonters. Decisions made at the federal level that will absolutely impact. So I am hearing concerns. I don't know if you've had constituents reach out to you as well, or
General kinds of concerns, not anything specific. I mean, people who are scared they might lose their insurance, or their 24-year-old won't be able to stay on their policy, and all those kinds of things, but not in terms of their dealings with Vermont Health Connect or the insurance here, or just that the premiums have gone up too high, which we all knew would happen. But
that was a matter of time.
All payer. I've heard a number of people ask, so what is all payer? And I can't give them a good answer. And I don't know too many people that can right now. I'm hoping there's a big push to try and get some more information out about this, because especially elders are concerned that it's going to compromise their Medicare. And I think we haven't done a good, I have to say, because it was done when we weren't there. Some of the groundwork was done last session, but this all's moved pretty fast. What can we do to better educate the public about all payer?
Well, I personally think it's a good start. And I know there are concerns. I have reached out to Robin Lunge and asked if we can have a session down here, and she's going to talk to Al Gobay, who's the chair of the board, and Lawrence Miller, and get a couple people to come down, not to do the presentation like they did before, which was kind of the initial thing, and there weren't a lot of details, and as we go forward, more and more details will emerge, but to listen to people's concerns, and so it's more them listening to the concerns of the community. I know that mental health agencies have some fears about it, and private practitioners do. So we're going to try and get that set up for sometime mid-December.
That's a great idea.
I'm not sure who she'll get to come down, but she's said that they're committed to doing something, and so.
Yeah, I certainly have gotten questions both from constituents and also from, I think I mentioned to you, my doctors when I go in, they want to talk about it.
I know, isn't that, okay, your knee is just fine now, let's talk about healthcare reform.
Well, providers shouldn't have to know all that. They should be focused on healthcare, and the insurance should be here, but it just covers so much people's concerns.
I think it's going to be a great system, because the system we have doesn't work. We know that. It doesn't work, and it's too expensive. And I think this will, and it's all about the details, of course, but as they keep saying, this is a provider-run system, not a state-run system. So we'll see what happens.
I mean, on the issue of healthcare, just because I didn't want to forget to mention it, one of the things that I think is very exciting, for me, sort of a ray of good news in recent decisions that have come down on the federal level, is this rule that was just passed to allow nurses and PAs to prescribe Suboxone in order to do treatment. I mean, that's huge. We have such a backlog of people waiting for treatment, and so my understanding is after 24 hours of opioid treatment training, nurses and PAs would be able to see 30 patients, and then after a year of successful completion of having these folks within their practice, they could then apply to see 100 patients. And then doctors as well will be able to see more. So it's huge. I was really hoping it would go that way. And we need all the help we can, because as you know, when people decide that they're going to finally deal with their addiction, the worst thing is to tell them we got no room for
4
you.
months from now, you
Ex-
can see someone.
exactly.
And I know there are areas where it'd be only perhaps one physician who was prescribing,
Right.
ready to retire, and
Exactly.
Yeah.
Well, that's
questions who's
right.
going to do.
I mean, yeah.
I'll add, though, I think we do need more residential beds. The idea that this is the best way to treat addiction, I don't think is bearing out the outcomes. I think residential treatment as a start is the best way to go. And the way to get around, but we're going to have to spend money on these things,
Yeah.
along with our whole mental health system.
Right,
The idea
right.
that people continue to be stuck in emergency rooms
Sure.
for long periods of time because we don't have beds
Yeah.
is really becoming untenable. And we need more beds. We're having a problem with Woodside now because it's been going to be defunded by Medicare.
No,
We may have
Medicaid.
Medicaid. We may
Right.
have a similar problem with our Berlin facility
Absolutely.
because it's too big. But we do need more beds. And I think the regional approach is the way to go. But I don't think we can get around that we need more beds, that emergency rooms are not good treatment.
No.
They aren't treatment at
No,
all, good
no.
or bad.
Yeah.
They're
Right.
not treatment.
And it's not good for the patients, it's not good for the families, and it's not good for the staff
Right.
No.
at all.
And the other patients
Absolutely.
that are
Yeah.
in the emergency
It
room.
is,
Yeah,
um,
it's,
I don't disagree with you.
Yeah.
Yeah.
It's certainly a matter of often funding, right? So how are we going to pay for that? But I think we know that is true.
Are there bills you've got lined up, ready to go, or have you asked for drafts to start already? Or, as I said earlier, things left over that you didn't get to last year?
I don't have any draft requests in yet. I will.
Yeah, same.
But I don't have any in yet. I wanted to make sure that I was reelected before I put in any draft requests.
You don't want to
It's
be
a little bit
presumptuous.
embarrassing.
Exactly.
Yeah.
Exactly.
So, but I have some that, but mainly I think they're things that have come through from last year, like, and a couple of them will be placeholder things, like for looking at the law enforcement. That will be a
Right.
placeholder bill. I don't have any details
Yeah.
at all. So, and then individual requests. And I think that we should let people know
This
that
is the time?
that
Yeah.
if you have an issue, this is when to get in touch with us and to say,
Exactly.
this is an issue for me. I mean, I have a couple of those
Yeah.
right now,
Yeah.
like those crazy landlord certificates that get sent out to tenants for their rebates.
Yeah.
It's a crazy system.
It is.
It's a
And
crazy
it's not
system.
as well used as we hoped it would be, so I'm not sure it's
Effective.
effective.
Well,
yeah.
it's a crazy
Yeah.
system. But anyway, and things like that
Yeah.
aren't huge issues, those big general issues, but
Yeah.
are individual issues.
Yeah.
So
Do you
And-
have any?
Well, I just had a question for Senator White, and I know that there have been additional hearings that have happened between the session on where to go with medical marijuana. How, what are the issues that are coming up now that Mass has and various states have moved forward on legalization? I'm wondering if there's anything that you can share at this point. I mean, I definitely heard.
I'm not on that
Yeah.
that corrections committee
Yeah.
that's been looking at it.
Yeah.
I think that I mean, personally, I'd love to see us move forward with it,
Yeah.
but I don't know where Phil Scott stands on it, and as of last year, he said he would veto. So whether Massachusetts changes his mind or not, I don't know.
Right.
And I also must say that there were only 24 people in the House who voted for it last year, and I don't think there's going to be that much of a turnover in the House. So I don't know if anything will happen in the House.
Okay.
Right.
Yeah, no, it's a
I-
good
Well,
I
actually,
point.
we regularly turn over 30%.
Right, but
Every election.
that doesn't give you enough
Yeah.
to do anything. So I don't know what's going to happen with
No.
it. I would be happy, I think Joe Benning and I would be happy to put the same bill in.
Was
as
your
it ended
question
up.
about recreational or medical, though?
Well, I know there have been some discussions about both. And
Yeah.
so I've just heard in the ether that some additional hearings had happened, public hearings.
Okay.
And that's all. I was just curious.
I think it's that the corrections oversight, it isn't corrections oversight. I'm not sure what the committee is, but, and I don't know if they've focused on recreational or medical. My guess is there'll be, we have adjusted the medical bill every year, I think, since we passed it.
Yeah.
And my guess is that there'll be some suggested changes again this year. I know that people are interested in PTSD.
Yeah. I have heard that
Particularly
from- yeah.
for veterans, I've heard, but I'm not sure that even if we did that that it would help veterans, because I worked with a couple veterans who would have liked to use it not for PTSD but for pain management.
Yeah.
And it's still federally illegal, so
Yeah.
if they go through the
Sure.
VA, they can't do it anyway. So I don't know what we'll do.
Yeah. Yeah.
There was just a piece on the radio today that people are petitioning the National Football League to allow marijuana to be used as a pain,
Oh, interesting.
for pain relief.
Yeah.
And nationwide, there are a lot of people who die from the painkillers that are out there, the prescription painkillers.
Oh, yeah. Yeah.
And if we
And
could
become addicted.
And become addicted.
Addicted, yes.
Yeah.
Some of them now are using marijuana and getting good results. So maybe that's one way, another way that this can be used.
Yeah.
And if the National Football League is starting to talk
Yes.
about it, that's opens a
more
lot of
mainstream.
doors. Yeah.
Yeah.
Doesn't get more mainstream.
Yeah. Yeah.
We've got about 3 minutes left. As we look ahead to the next session, we talked about some things we want to do. The process of a bill. Just remind people how difficult it is to actually get a bill, how many get put out there, why bills. There seems to be a lot of good ideas.
Yeah. Do you know how many offhand were introduced last?
Probably around 1,200.
Yeah.
Okay.
And we usually pass around 200.
Yeah.
I mean, that doesn't mean that 1,000 of them didn't get addressed, because sometimes 4 bills become one.
Right.
Yeah.
Right.
But it's hard. I mean, we have 180 people,
Yeah.
and we all know we're right,
Yeah.
and we all have our own ideas. So we have to convince 179 other people, or as they say, 76, 16, and 1.
Yep.
76 in the House, 16 in the Senate, and the governor.
Yeah.
Right.
In order to.
Yeah.
And get your bill out of committee. I mean, that's the other
Right.
piece too.
Right.
Is that, you know, if it doesn't ever get off the wall, as we say. And so, but not to be discouraging. Again,
Yeah,
I mean,
yeah.
I want to go back to what you said, Mike, which is that if there are concerns that constituents have, now is the time to reach out to us. I know there's been a game warden here in town who had a bill put in by Representative Burke some years ago. He met with us again recently about looking at perhaps reintroducing that bill. So if you have a pressing concern, please don't be put off by the process. That's democracy. It's messy.
And
Yeah.
the other thing to remember is that I've had people suggest that I let them know when bills are going to come up that are of an interest to them. We can't do that with all the constituents and all the issues and
very
all the
difficult.
bills. So what people should do is find someone who's either an advocate or a lobbyist or someone who follows that issue and those bills, and get on their email list and go to the legislative website
Right.
every day and look at the
Right.
calendar, because it's posted on there.
Committee calendars are also
Committee
there.
calendars
Yeah.
are posted every day,
Yep.
and new drafts
Yep.
are now being posted as they're put up. And if you want to have input into the process and into the development of a bill, it's at the committee level.
Yep.
Once it gets out of the committee, you really don't
you-
have anything.
You don't have to go to the State House to testify.
No, you
can
either.
do
it
You
on
can
the
take
phone.
Telephone
We took quite a
testimony.
few.
Yeah.
Yeah. So if people want to get
Yeah.
in touch with you, what's the best way to get in touch with you now?
Legislative email.
Yeah.
Or my home number is 387-4379, and it's in the phone book under Jeanette White.
Yeah.
And I'm the only Balint in Vermont. So 257-4162 right here in Brattleboro. And again, you can always email me at my legislative email address.
And then the caveat I like to share is that we don't have staff
Right.
Right.
who
Yes.
do our emails and take our
No,
calls.
no.
So please be patient. We will
Yeah.
get back to you,
Yeah.
but it takes a while.
It does. I'm getting back to some people who called me in March.
Yeah.
I mean, who emailed me,
Yeah.
and I read them, but
It is not humanly possible to get back to everyone in a timely manner. It's
Yeah.
just
it
not.
just isn't.
And I wish that were not the case. And we prioritize. As if we know something's going to come up,
Yeah.
immediately we're going to get back to the people calling about that. And if it's somebody who is calling about something that is not immediately compelling, then it's going to wait. Or if I have someone, oftentimes I'll have a list. I was telling you,
Yeah.
I have a list of things I'm going to get done, and then somebody will call with an urgent problem with Vermont Health Connect or something else, and they're going to get bumped to the
Yeah.
top of the list.
Yeah.
And
so-
I would add, as much
yeah.
as there are legislative concerns, we're also there to help with those constituent concerns, whether
Absolutely.
you feel like your grandmother's not getting heating assistance
Absolutely.
Right, yeah.
or needs
Yeah.
help in some other way.
Yeah.
Please, that's another way we can help.
And we can help put you in touch with the people who can help you.
Right, that's, yeah.
Yeah.
And then hopefully we can help create systems where people don't need to call us for
Yeah.
help.
Yeah, in the best case.
Right.
Well, thank you so much
Thank
for
you,
taking
Mike.
the
Thanks.
time.
Appreciate
Thanks
it.
for
Look
doing
forward
this.
to getting back to work.
Yes.
And
Yep.
it's coming fast.
It
It
is.
is.
So thank you, and thank you to the people here at BCTV.
Thank you.
You've done a great job and continue to bring the work we do in Montpelier closer to home, so there's a better connection for everybody. So we appreciate all that's done here. And until next time, take care. Bye-bye now.
Bye.
Bye.